Palliative care. Module content. Module outcomes. Aim of the module. Why palliative care? What is palliative care? Integration of palliative care into national health systems across Europe. When is palliative care? Palliative care practices. Where is palliative care applied? References. At the end of the module, patients and their families. Know the definitions and the basic principles of palliative care. Know why palliative care is a human right. Know the main aspects of the patient-centered care plan in palliative care. Know the different settings in palliative care, hospice, hospital, home care, etc. Aim. The aim of the module is to promote the acquisition of knowledge regarding palliative and end-of-life care in all age groups, and to provide the main indications regarding hospital, home and residential services. Why palliative care? Global population is increasingly aging. Increased prevalence of non-communicable diseases and the persistence of other chronic and infectious diseases. The population in need of palliative care is estimated to rise significantly in the future at the global level. What is palliative care? In 1990, the WHO, World Health Organization, gave the first definition of palliative care: active global care of patients whose pathology no longer responds to healing treatments or treatments to control the evolution of diseases, healing medicine. Control of pain, other symptoms, and psychological, social and spiritual aspects is of paramount importance. The aim of palliative care is to achieve the best possible quality of life for patients and their families. The integration of PC into the national health systems across Europe. The majority of European countries, 76%, have adapted their general health laws with decrees relating PC as a right of the patient, or even as a human right. 8 countries in Europe have a national law specific to PC. When is palliative care? Figure illustrates how the idea that palliative care is relevant only to the last few weeks of life is being replaced with the concept that the palliative care approach should be offered increasingly alongside curative treatment, to support people with chronic progressive illnesses over many years. Palliative care practices. The global care of both the patient and the family, controlling pain, other disturbing symptoms, supporting social, spiritual and psychological problems. The first multidisciplinary examination, palliative doctor and palliative nurse. Activation of the other professionalism of the palliative care team, psychologist, physiotherapist, nutritionist, etc. Assessment of patient and family awareness of diagnosis and prognosis. Support for the patient, the family and the family doctor in decision-making processes. The availability of program telephone contacts necessary to the adjustment of drugs such as painkillers and other symptoms controlling drugs and telephone contacts for psychorelational support. Palliative care practices. Planning of clinical checks and/or subsequent contacts. Interviews with the family to align the information and to assess the psychological relational needs of the family members. Relational and psychological support. Activating the psychologist of the palliative care team, for caregiver and other family members. The accompaniment of the patient and the family in the acceptance of the advanced phase of illness, aimed to achieving the best possible quality of life for the patient and for the family. Regular telephone and email contacts and comparisons with the general practitioner, GP, the reporting doctor and nurse, and with the coordination center of the palliative care network. The continuity of care, dealing with the GP to activate the most appropriate mode of home care, and the assessment of the inclusion in the pre-list for the hospice. Where is palliative care applied? Home. Health palliative care teams work in patients' homes, in collaboration with the basic health teams or nursing home staff. Outpatient. Public or standalone points to guarantee suitable services for self-sufficient patients who require specialized multidimensional assessment for optimal control of symptoms, including pain and family support. Hospital. Where palliative care team supports chronic patients. There may be specific palliative care units in highly specialized hospitals. Hospice. PC is provided in standalone facilities called hospice. The concept almost always designates an intermediate care resource between the hospital and the home.